You and Roy want to take care of this. Update on our command team.
Good morning.
Good morning, Kathy.
The rest of the command team is back doing, we have some calls that are required for planning, so they are on the planning calls right now. So just a quick update right now in Clay County. We have 43 positive cases. That's not showing on the website yet because there is sometimes a delay. I usually get the notification before they're officially all put on. So we have 43 in Clay County. And the Minnesota numbers are around 1650. That also changes on a regular basis. Cass County has, in North Dakota, Cass County has 116 positive cases. So Clay County has 43, Cass County has 116 at this time. Most of our cases in Clay County, the highest percentage are people that are in their 50s and 60s. That's where we're seeing the largest number of cases, but we're seeing them in all age ranges. We actually even have a 2-year-old, and we have a 19-year-old. So we're seeing cases in every age range, but right now the majority are 50s and 60s. The 70s and older, we have about 6 cases, so that's not even the largest group.
So we're not having that high a percentage in nursing homes and stuff.
Well, you know, we're seeing some of that increase, so that typically has been the case around the state, that nursing homes, once there's a positive case, it's really challenging to keep that under mitigation. So we are seeing cases in nursing home facilities that are ramping up. So what the information I receive from the state, I do receive age ranges, I'll receive the gender, I receive information about which city it is in Clay County and whether it was what they call community spread, which is the majority of what we're seeing now. Initially, when we first were receiving information, it was about travel, so international or domestic travel. Now most of it is community spread, is the majority of what we're seeing. And then I'll receive information whether they were connected to a previous case, but I do not receive names of individuals, and I do not receive addresses. So it's still pretty confidential. The information, the only time I'll receive a name and an address is when the individual requires some essential services. So if public health needs to assist them with, they need food access because they can't be out, or they need some medication, etc. So we work with them on whether they can, get food delivered, if they have friends that can deliver it, or medication. So we work with the individuals. I believe we've only had maybe 6 that required us to communicate with them about essential services. Now the food pantry has given us that we will be receiving actually is a few boxes of food. So if there's ever a need after hours when the food pantry isn't open, or if we need something on the weekend and it's urgent, we have the ability to get some food out to people. So we'll have those stored in public health. And of course, the sheriff's department is delivering, food items as well to people. So we have the ability to meet some of the needs. We haven't had any issues so far with the 6 that we're dealing with that providing essential services. We're able to work out plans with them about how they can get all of their essential needs.
Who maintains this list that you say we have no knowledge of?
I received the list from Minnesota Department of Health. They send the list in Minnesota. In the state of Minnesota, all the lists go to the public health director. And so I maintain the list in my agency, and then it's kind of a need-to-know basis. I do know that the governor issued an executive order where he'd really like first responders or those who may encounter individuals for safety reasons. He would like more information for those individuals, specifically a need-to-know for first responders and others. And Gabe isn't here, but they don't know how that's going to roll out yet, whether it'll come through public health or maybe they'll get it directly. So there is going to come a time shortly where first responders will be able to get addresses. They will not have names of individuals. in the event that they will be encountering an individual for an infraction of some sort, that they'll know that this person is actually positive. So they'll get addresses, but not names.
Mr. Chair, right?
Kathy?
Just a minute, Jenny.
So,
Yeah, I'm sorry, Kevin.
no, so the ability to do contact tracing, from what you're telling me, we're not doing any of that.
Contract tracing is happening with Minnesota Department of Health. So they assign a case manager to every case, and that case manager is reaching out within 24 hours of their notification that the case is positive, and they are doing all the contract
Okay, so
tracing.
it's being done.
It is
It's
being
just not
done.
being done by
Correct.
Clay
It is
County
not-
Public Health.
Right, it's not being done by local public health. If Minnesota, and they have a number of individuals, I want to say 70 is what the last number I heard across the state, that are able to do the contact tracing. And if they become overwhelmed and they just run out of people, or they just cannot keep up, that's when they'll notify us to do that.
And are you equipped to do that?
We are. We will get the screening tool that Minnesota Department of Health is using, and we will be equipped to follow up with all those cases. We are equipped with the information and knowledge. I'm not saying we're equipped with the manpower, so we'll see how that goes. We're hoping Minnesota Department of Health will be able to keep up, but it certainly is a large task to kind of.
Well, I asked that not only for now, but for the future, because it sounds like contact tracing is going to be an important piece of the future when we go back to some form of reality here.
Right, that's right. So, yeah, that's still, Minnesota Department of Health has assured us there will be plenty of time that they'll notify us that it will become a local public health task. So at this point, they're very confident they're able to keep up for quite some time. So we'll be doing some planning in regards to that with my team.
Very good, thank you.
Jenny, go ahead.
Thank you. Kathy, I understand and appreciate HIPAA laws. With that said, I've had several residents reaching out to me and concerned that we have the information on where the locations of the positives are, but we're not sharing that. And what I mean by that is either saying this percentage of the cases in Clay County are in Moorhead, this percentage of the cases are in rural Clay County. I understand that we may be cautious to do that, but I've had about 3 individuals in the last week really saying, the more information we can have, the better, because we're hearing that it's either all in Moorhead and not in rural, so we maybe don't need to maintain the social distancing aspect. Obviously, that's not the right route, but is there any way we can share any more information?
And I say that I get the information on the cities, but Minnesota Department of Health has clearly said we should not be giving out cities. We should only be saying Clay County at this time. So I can push that message up, Commissioner Mojo, and see if they are willing to allow that to happen at this time. But currently, the information is just that we should not be giving out individual cities to the public.
Okay, and I appreciate that. I just think that if there's any way we could be discreet in just identifying maybe either northern half of Clay County or the southern half, or rural versus the city, that may be helpful.
Sure, and we can see they've really put some hard lines on that, but I can certainly, as this evolves, social distancing is our mitigation tool that's the most effective, and they really like us to just, everyone, no matter what, consider that the people around you could be carrying the virus, because you can carry it for a couple of days before you become symptomatic. So in other words, you can spread it to another individual. So that's the biggest thing, is you just anticipate that everybody in the community could be a carrier, and so social distancing is just the most important strategy. And then, of course, you see a lot of people out there now wearing their cloth masks. Now, as I talked about the last board meeting, the cloth mask is not a medical grade, so it will not protect you from another individual, but it protects the other individual. So if you're coughing and sneezing, at least you can contain it within that cloth mask. So that's just another strategy to, and there's people out there that are wearing a variety of different cloth masks. The medical grade, and the reason why they're not pushing that so much is because there's still a shortage. There's a shortage of surgical masks, and there's a shortage of N95 masks. So they really want those for those that are caring for individuals that are positive. So that would be all of those people in healthcare, as well as even people in the congregate care livings that are caring for people that are positive COVID. So those are just on reserve. If we tell people to get surgical masks, we're already in the hurt bag with getting the resources for that. So, but I certainly will take that information that you were talking about, and I will have some more communication with our MDH partners.
Thank you.
Sure. So we talked about the executive order, the governor's executive order. I believe I talked about that at the last board meeting, but just to reiterate, that stay-at-home order, he extended that to May 4th. So that is the governor's order that we just, because of the this novel infectious disease is, and again, it spreads so easily that we need to maintain that social distancing. That's the biggest tool we have right now without medication to avoid the spread. You need another person to spread it to. So if you can socially keep your distance 6 feet and beyond, that eliminates the spread to another person. So he has executed that order to May 4th. I know he's had some discussions about a slow opening of certain facilities and businesses, but we haven't heard any detail about what that may be at this time.
I have a couple of questions, but I can wait till you.
Okay, so we are providing a lot of information out to the public. We are providing it via, it's on our webpage, it's also on our public health Facebook. So there is a great source of information that is going out. We also have information going out to our employees, specifically if there's like cleaning information was one of them, cleaning the office spaces. What do we do if we have a positive COVID employee, or if there's somebody that's been in contact with someone who potentially has COVID. So we're getting a great number of questions from employees and the general public. So we have someone working on responding to all of those very quickly. We also are working with our long-term care facilities. We've spent a great deal of time getting information to them and helping them work through. We have one facility in our community that really needed some pretty specific information, and we needed to work through some processes with them about having COVID positive residents or staff. So we've done a great amount of work with those facilities to help them operate safely and to work through some staffing issues that they have, because of course, you know, you have the fear of people, and we know it's out there that the minute they hear COVID, they're concerned, and so sometimes staff do not want to work. So we're working through that issue directly. Let's see, what other things? And I talked about the liaisons. No, I did not. We have liaisons with the long-term care facilities. So we will be reaching out, those that may have a case and those that do not. So in our community, any congregate care living, I have now specific people signed up to communicate with them on a regular basis to help them through the process. So many of them have a lot of questions and concern. So we can help them with that process. So we have what we call the congregate living liaisons, and those are our nurses that will work through processes with them. They'll be in direct communication. It may be daily, but we'll be working through that process with them as well. Any questions?
So I have a couple of things here. First off, going back to the 43 cases, do we know how many of those are hospitalized?
I believe 5 of those are hospitalized.
Okay.
5 are hospitalized.
Which brings me to my next couple of questions. We always hear about, all these different areas and when we expect to see a peak? Do we have a peak for Fargo-Moorhead area? What they're suggesting is a peak period of time?
Yeah, at this point, what we're saying is we haven't reached our peak. Once we reach our peak and see a decline, but we have not reached that peak yet in the Fargo-Moorhead area. In talking with our healthcare providers, so we have regular calls with Sanford and Essentia, so they're keeping public health up to date on what is happening in their facilities. And as you know, it was actually put out there in an article that the Fargo Dome is going to be a facility that they can use for surge. So just as of yesterday, they really have low numbers of those that are dealing with COVID cases. So that's good news. They're not really seeing a high surge yet where they need to even use another facility. They're able to manage with the equipment and the beds, the ICU beds and other beds. So their numbers are quite low, so that's a very positive thing. And it would be nice if they would maintain that, but we all anticipate that they may see more down the road and there may be a higher surge, but right now they're managing quite well as of yesterday.
So speaking of that surge, and I saw that report about the Fargo Dome, let's hope that it doesn't get to that, but if it does, most of our citizens in Clay County get their medical services across the river in Fargo. And I'm assuming then that if there got to be a point where there was significant where they had to use alternative sites, our citizens would still qualify for it. We don't have to be looking for sites in Clay County, do we?
That is correct. Our citizens, everyone they serve.
I don't want a surprise later, so.
Very good question. Everybody they serve will be served by their health facilities that they utilize now. So yes, they'll be able to utilize all of the services. So the Fargo Dome is open to everyone that's being served in our region, actually. So
Let's just be hopeful that it doesn't
Yes.
come close to that, but.
yes,
That was my question also, whether we can utilize that facility, so.
yes, absolutely.
Good question, okay. Any further questions, or go ahead? Oh, you got more?
Well, just to say that, I believe the press conferences will continue tomorrow again. We had the Metro-wide weekly press conferences. We didn't have one last Wednesday, but I believe, actually, some of my staff are on call about that right now, so we'll see where that's going to go. I'm assuming we'll have it. I don't know if it's going to be virtual or in person, so we'll have more information and I can pass that on.
Okay.
Okay, that's it for my report, other than the next agenda item.